So the topic is osteomyelitis. Osteomyelitis, depending upon the time, will be maybe acute osteomyelitis or chronic osteomyelitis. The route of spread for osteomyelitis will be hematogenous route, and the most common bone affected is vertebra. Femur is more commonly affected than tibia because there is a hairpin loop arrangement of blood vessels which leads to sluggish blood flow, and hypoxic and ischemic conditions are created which leads to flourishment of bacteria in that region. Moreover, the area is highly vascular and lacks macrophages, so there is ample growth of bacteria in this. The most common organism causing osteomyelitis is Staphylococcus aureus. The sequelae for the infection is, first of all, there is inflammatory response towards the bacteria, followed by an abscess formation which progresses into a sequestra. The sequestra further forms a draining sinus. So, the pathological hallmark of acute osteomyelitis is an abscess, and it is clinically represented with fever and pain at the site. The management will be, first of all, a complete blood count to estimate the level of infection, ESR CRP, and then coverage with broad spectrum antibiotics. Supportive treatment like ice packs, splint, and rest are provided, and symptomatic relief with analgesic, antipyretics, and antiemetics are done. The treatment plan will be, if it is a less than 24 hours episode, then IV antibiotics for 2 weeks, followed by 4 weeks of oral antibiotics. And if it has been a chronic case, then we will be doing drainage under antibiotic coverage, and then followed by antibiotic support. Complications of acute osteomyelitis will be progression into chronic osteomyelitis, pathological fractures, septicemia, altered growth, and even improper fracture healing. Chronic osteomyelitis, the hallmark of chronic osteomyelitis is sequestrum, and it is clinical hallmark will be active discharging sinus. There are various types of sequestra depending upon the type of chronic osteomyelitis. That is, if it is pyogenic osteomyelitis, there may be tubular sequestra. If it is viral osteomyelitis, it will be fine and sandy. And if it's fungal osteomyelitis or actinomycetes, it will be black or coke colored sequestra. In syphilis, it is ivory sequestra, etc. On X-ray, we will be seeing calcification in the bone with a translucent or lucent boundary, which will show the dead bone in the between and the involucrum surrounding the abscess. Then management will be, in chronic case, same complete blood count to estimate the infection. Then coverage with broad spectrum antibiotics. A sinogram, if there is a sinus present, a sinogram will be helpful in tracing the path and progressing with the treatment. Treatment will be antibiotics, sinus tract excision, sequestrectomy, debridement, curettage. Saucerization is a process in which the excess bone is removed surrounding the area, and we will then, if excessive tissue is removed, we will provide a bone graft and a muscle graft also. We will cover the part with muscle, that is myoplasty, and negative pressure bandage will be done so as to promote faster healing and a gush of nutrients and blood towards the affected organ. The complications will be same like pathological fractures and acute exacerbation into osteomyelitis, a spread to a distant site by hematogenous route, and even progression into squamous cell carcinoma. Another case which involves pain and fever will be septic arthritis, infection of the joint, which is more common in children, and most commonly the knee is infected in children, and in infants it will be the hip that is infected. The route of spread is same, the hematogenous route, and the causative organism is also the same, that is Staphylococcus aureus mostly. In case of IV drug abusers, it will be Pseudomonas, and the clinical features will be fever, pain, pain on movement, pseudo paralysis, etc. And generally, the position in which the patient will keep the limb resting will be at the position of ease, Like if the hip joint is involved, it will be flexion, abduction, external rotation, that is Faber, and the knee, the relaxed position will be flexion. Management of septic arthritis will be blood investigation, which will help us to assess the level of infection, X-ray to assess the joint involvement and erosion, ultrasonography in case we are planning for an arthrocentesis, the aspiration of excess fluid. Treatment will be arthrotomy, irrigation of the joint, and excess joint debridement. If the treatment is delayed, it can progress into a complication which will lead to ankylosis of the joint, and because of the release of collagenases and elastases, the joint erosion will be massive. After the joint erosion has happened, it might progress to healing like a fracture. So the joint may become immobile, and the joint may even erode so much that the two bones are fused together. Some common conditions which lead to septic arthritis are pyogenic septic arthritis or tuberculosis of spine, ankylosing spondylitis, rheumatoid arthritis, and